I did a part 1 of this YouTube, the more pathogenic phase 2 biofilms. If we have effective treatment, either a drug or supplement or whatever, that goes in there, suddenly your immune system biochemically sees these infections it hadn't seen before, and it can be surprised. Hey, I'm Dr. A. Welcome to my YouTube channel. I've been researching and teaching in the naturopathic and integrative medical communities for 30 years, and I have been seeing patients for a very long time, and I use this channel to answer people's questions. So in the first one, I explained how we get to the bigger skyscraper-like phase 2 biofilms, what they kind of look like pathologically, who's more likely to have them, all of that. But then we kind of ended at they can be a clinical management issue, if you will, because if you consider something that's, like a skyscraper size, a big biofilm, what it's been doing has been hiding from your immune system largely a whole bunch of microbes. So when I talk about it, seeing and being surprised, it's more of a pathologic biochemical shift, but really that's a nice way to think about it because it's sort of like, well, all these microbes have been stuck in the biofilm. And now, in order to get you better, we have to break the biofilm down. But now we're also seeing all these microbes. Imagine your immune system going from, kind of low modulation to super high modulation because it's suddenly aware of these. So the segue into this talk is great. Okay, so wonderful. We put the biofilm advanced stuff in there. And now we've got all these symptoms. Number one, does that mean it's bad? Number two, what do we do about it? Now, does everybody get a huge level of inflammation and stuff like? No, not everybody does. But people who are sick a long time who have really bad biofilms often will somewhere in their body. So it's not that the treatment is bad, it's that we have to now manage a hyperactive immune response. We don't want to shut it off unless there's an emergency, but we also don't want it just going crazy and having all this inflammation running around. So you might say, well, where does inflammation come from this hyperactive immune response? The initial immune response that we have is very pro-inflammatory. Most of the cytokines, the chemical signaling things that are involved there are pro-inflammatory. So that's where the inflammation comes from. So on a spectrum of what do we do, if all else fails, you can shut the immune response off, which we don't prefer to do, but if it's an emergency, you can temporarily shut the immune response off with steroids. Now, that's not a good long-term strategy, but if there's something bad going to happen or the person can't move, you kind of have to do what you got to do first to no harm. Most of the time, you don't need that. Most of the time, what you need to do is a couple of things. One is in many people, especially if they've been chronically ill, if they've had a lot of therapies such as anti-infective therapies or chemotherapy or other suppressive therapies, anybody been sick a long time, most of the time those people also kind of have lower levels of output from their adrenal glands of their corticoids. Now, why would I bring this up? Well, but what's supposed to happen when you get the upswing in immune function is that your adrenals are supposed to respond to that and have a higher level of cortisol that they put out to help modulate. It's not shutting off the immune response, it's modulating it. And if you have burned your adrenals out so that they just barely puke out enough cortisol every day to keep you alive and keep you not being diagnosed as Addison's disease, which is very common. So you don't have a disease, you just have kind of weak adrenals, then you might need some help there. Now that could be in the form of natural supplements, that could be in the form of low-dose hydrocortisone to replace what's missing. And again, not a suppressive dose, just low doses, whatever it takes there. So there's an adrenal component. Much more rarely, but I'll throw it in because it does happen. If the person's thyroid is really unbalanced and then they go into this phase 2 biofilm response, it's inflammatory. Sometimes their imbalanced thyroid will become very imbalanced and they might need some thyroid support, but that's less common than the adrenal thing. The other thing is that you need a kind of a 1-2 punch when it comes to the therapeutic end of things. And that means you need something broad spectrum to kill the bugs that are now being seen by the immune system. So the immune system doing part of the job, but we want to help the immune system and kill them. And then the other thing is to mop up. So there's going to be a lot of cellular debris and inflammatory debris, etc. So we often will use binders for that. So that's the 1-2 punch. So we're going to support whatever endocrine things need. Usually it's the adrenal function, and then we're going to kill things. Now, I prefer actually broad spectrum things, and there's not a lot of drugs that are truly broad spectrum, meaning there's not a lot of drugs that really actually would cover more than whatever they're made for. There's a couple, but they're not that broad spectrum. So I tend to use aromatic botanical extracts because, for example, high concentration oregano is known in research to not only kill bacteria, but also fungus. It helps with some viruses too. Sometimes the berberine family, berberine family, Oregon grape, things like that, high concentration, very broad spectrum, and there's others, and you can rotate them, etc. Now, these are not things that usually, like the culinary levels of these things are not going to be strong enough. You need sort of a higher level, but basically I prefer those. Now, sometimes if we already know somebody has a really bad bug in there, let's say there's a parasite or, maybe a really bad bacteria or something, we might add to the herbs with a drug on top of it. But really the broad spectrum herbs work really well. So that's part one of the 1-2 punch. And then at some point throughout the day, we're going to educate people on high fiber foods, because high fiber foods will mop up a lot of this debris that's going to be coming out as you have the war going on with the phase 2 biofilm creatures. And then often, after dinner or maybe at bedtime, if they're not taking other medications at bedtime, we might give them an actual binding substance, whether that's a fiber or activated charcoal or whatever. But when you get this response where the body starts to be inflamed because you're now seeing all these creatures of various types that you weren't seeing immunologically before, what you need to do is to manage that response. So first, you want to consider that the adrenals, which are supposed to rise to the occasion, may not be rising to the occasion, might be natural support for them. Like I say, might be low dose hydrocortisone at non-suppressive doses, might need some thyroid support, might not. And then the 1-2 punch of killing and mopping up that we have to do to help. And then this usually curtails a lot of the overly aggressive phase 2 biofilm disruption. Now, another thing that can be very helpful, which a person probably should have been on before, but if they weren't, at some point during the day, we will also give them some probiotics, and different probiotics do different things, but probiotics become very, very important in this particular fight that goes on. All right. I hope that answers the question. Again, if you're watching this one and you're wondering what I segued from, we will probably link part 1 down below. I'm Dr. A. Thank you all the new subscribers. Thank you all the former subscribers. Please do continue to like, share, subscribe, and get notifications. It's really helping. Community's growing. I'll see you all in the next video.